Liquid rhinoplasty. Is there really such a thing? I get so many questions about that on my website and my Instagram, and you know, it's really kind of a misnomer because it's a filler to the nose. I mean, there's no such thing as you doing a liquid magic rhinoplasty. You know, we operate with scalpels, not wands, and certainly it's not liquid, it's a gel. So let me just walk you through who is a candidate and when you should do it, when you shouldn't do it. First of all, it should be done by real board-certified plastic surgeons or rhinoplasty surgeons that are experts, because while it's a safe procedure, it can also be very dangerous. It can cause damage to the skin and rare cases of blindness, so be careful. Don't have it done in a spa, because you gotta know before you go or you'll lose some skin or your eye. So having said that, I do it all the time. It is great for patients that want to test drive a nose job potentially, just want a subtle change in their nose for the summer, or they want to just see what it looks like. And then I do that all the time. But if you're going to get married in a week, you know, come see me 2 weeks before. And if you want to have a rhinoplasty, you need to see me 6 months before. I see that a lot too. There's some caveats. One is, make sure that you know that anytime you do a filler, it makes your nose bigger. You need to know that, and you can't fully correct. If you have the bigger the hump, the bigger your nose will be. And it can bring the tip up a little bit only. So, and sometimes you've got to have a lot of the finesse of understanding the 5 steps for doing it, and only an expert can really understand that, both safely and doing it correctly. Basically, you stay midline, stay deep. So that's very important, and you can get some amazing results in 10-15 minutes, but I don't ever inject more than a cc. I usually use a hylaronic acid filler. These are all things you need to know. Are you a rhinoplasty expert? You know, and then I watch them, make sure they're fine. I get photos, and I always see everybody back in about 4 weeks, because if they need a little bit more, we do that. So, know before you go, it can be bigger. It's temporary, lasts up to 12 months, sometimes longer. And if you use an HA, hyaluronic acid filler, then it can be resorbed or removed if you're doing a rhinoplasty. You know, up to 50% of my patients actually have a rhinoplasty. They do their summer thing or their college year, and then they have me do their rhinoplasty in the summer. So it's a very reasonable thing to do. Now, some don'ts. If you've had a previous rhinoplasty, you for sure should make sure that you can have an expert rhinoplasty surgeon do it, because the blood supply is different. And I do that every day as well, but the blood supply is different, so you have a much higher risk for having problems if you don't know what you're doing, and also if you don't know the anatomy because of the scar tissue. So it is possible to do it in revision rhinoplasty patients or patients that have a little bit of irregularity. I do that a lot, but it's a different procedure to do that. So know before you go, find an expert. Your nose will be bigger. Make sure that you use a hyaluronic acid safe filler. Never use a permanent filler. Never use silicone, any of those other things. Okay, they can really cause long-term damage. Okay, and these are just some caveats for you as you go on your journey on finding someone to improve the shape of your face, your nose, and also to make sure that it's something that you really want done. So remember, always turn to my YouTube channel if you want someone who's a trusted expert in rhinoplasty, a trusted expert in facelift surgery. Know before you go.